Have you ever stopped to wonder what's really happening inside your body as you age, especially when it comes to something as personal and yet as important as your prostate health? Most men don't think about it until something changes. Maybe you wake up more often at night to use the bathroom, or your energy feels lower than it used to. Or perhaps you notice a difference in your sexual function, or like a conversation with your doctor suddenly turns into a moment of concern. It's at that point many men realize how much this small gland actually influences their overall well being. Let's talk about it openly, honestly, and without embarrassment, because this is not just a medical issue. It's part of your identity, your vitality, and your confidence as a man. The question so many quietly ask is this: does daily ejaculation, especially from masturbation, affect your prostate health? Could it be doing more good than harm, or are there hidden risks that no one discusses enough? The answer, as it turns out, is far more empowering than most people expect. The truth is that your prostate is not something you can afford to ignore. It's a vital organ that plays a central role in reproductive function, hormonal balance, and even urinary control. Yet for many, it only comes into focus when symptoms start to interfere with daily life. But what if understanding your body now could actually prevent those problems before they begin? What if you could take back control over one of the most essential aspects of your health starting today? Let's start by clearing up one of the most common misconceptions: that frequent masturbation or daily ejaculation is somehow harmful to the prostate. The science says otherwise. In fact, some of the most respected research ever conducted on this topic shows the opposite. A major long-term study published in the journal European Urology tracked more than 30,000 men for nearly 2 decades. The findings were astonishing. Men who ejaculated frequently, about 21 times or more each month, had a significantly lower risk of developing prostate cancer than those who ejaculated less often. This isn't speculation. It's hard data gathered over years of careful study. The reason behind this is known as the prostate flushing hypothesis. Think of the prostate like a finely tuned plumbing system. Every time you ejaculate, your body naturally clears out old seminal fluid, aged or damaged cells, and small amounts of inflammatory debris that can build up inside the gland. Regular ejaculation essentially works like a cleaning mechanism, keeping the internal environment fresh and healthy. Without it, those fluids can stagnate, encouraging local inflammation, oxidative stress, and possibly contributing to unwanted cellular changes over time. In simpler terms, consistent ejaculation helps your prostate stay active, clean, and functional. It promotes circulation, reduces pressure buildup, and maintains normal tissue turnover. Just like you wouldn't let dust collect endlessly in your home, you shouldn't allow old fluid and cellular waste to sit inside one of your body's most sensitive areas. So no, daily ejaculation is not harming your prostate. It may, in fact, be quietly protecting it. But here's where balance comes in. Ejaculation alone cannot compensate for an unhealthy lifestyle. You can't ignore proper nutrition, regular movement, sleep quality, or stress management and expect frequent release to solve everything. It's part of the puzzle, not the whole picture. Your prostate thrives when your entire body is cared for in a holistic way. That means paying attention to diet, exercise, hydration, and regular medical checkups. As you age, particularly past 40, your prostate begins to go through natural changes. One of the most common is benign prostatic hyperplasia, or BPH. It's a non-cancerous enlargement of the prostate that can cause a variety of urinary issues. The gland slowly grows and starts to press against the urethra, the narrow passage that carries urine from the bladder. The result? Weaker urine flow, difficulty starting or stopping, and that frustrating feeling of not being able to empty your bladder completely. For many men, this leads to multiple nighttime trips to the bathroom, poor sleep, and fatigue that carries over into the day. While regular ejaculation may help relieve some of the pressure within the prostate and keep fluids moving, but it won't stop enlargement altogether. The process is influenced by hormones, genetics, and lifestyle. Managing it requires a comprehensive approach, one that involves the right food choices, medical evaluation, and consistent physical activity. Another key factor is hormonal change. As men age, testosterone levels gradually decline, while the enzyme 5-alpha reductase converts a portion of that testosterone into dihydrotestosterone, or DHT. DHT is a more potent androgen that can contribute to prostate growth and sensitivity. When DHT levels rise unchecked, the prostate becomes more prone to enlargement. Interestingly, regular ejaculation may help maintain a more stable hormonal balance and receptor activity, keeping things in equilibrium. Still, this works best when paired with exercise, proper sleep, and stress reduction, all of which influence hormone regulation. Then there's the matter of cellular renewal. Over time, every cell in your body replicates countless times. And as years go by, small errors can appear in that replication process. These changes, combined with inflammation and hormonal shifts, can lead to abnormal cell growth. Frequent ejaculation supports the removal of old or damaged cells, essentially reducing the chance for these problems to take hold. It's one of nature's simplest and most efficient maintenance systems, built right into your biology. However, it's not just about frequency. The way you approach self-pleasure also matters more than most realize. One of the biggest mistakes older men make is assuming that force or speed equals satisfaction. As sensitivity decreases with age, some men instinctively increase pressure or rush through the experience, trying to recreate what once came effortlessly. But this habit can do more harm than good. Excessive pressure creates micro-trauma to delicate tissues, diminishes sensitivity, and may even cause long-term irritation. Over time, this can lead to reduced pleasure and dependence on a single kind of stimulation, making intimacy more difficult or less fulfilling. Another common issue is dryness. Without proper lubrication, friction increases dramatically, irritating the skin and underlying tissue. This can lead to inflammation, soreness, or even infection. A simple, water-based, fragrance-free lubricant can make a world of difference. It not only protects the skin, but also enhances comfort and sensation, transforming the experience into something therapeutic rather than mechanical. And let's not forget the mental and emotional aspect. Sexual health is deeply connected to psychological well-being. Many men, particularly those raised in conservative or shame-based environments, carry emotional tension around self-pleasure. That shame manifests physically in breathing, posture, and even pelvic muscle tone. When your body associates arousal with guilt, it becomes harder to relax and harder to experience true release. This tension can affect your blood flow and hormone balance over time. Learning to approach your body with curiosity and acceptance changes everything. The goal is not to perform or rush toward climax, but to reconnect with yourself in a calm, mindful way. Deep breathing, relaxation, and awareness can